spent and may actually save you time in the long run. Assess the patient and determine the best place for the IV. Identify an alternate insertion site should one be necessary. Gather all of the supplies needed for the procedure. Perform hand hygiene according to your policy and procedure. Open and assemble the insertion supplies, ensuring they are ready to go. Apply the tourniquet approximately 6 to 8 inches above the intended insertion site. Gently tap the vein to help distend it. Don your gloves and clean the insertion site with an appropriate antiseptic solution, such as chlorhexidine gluconate, and allow it to air dry. Apply traction to the skin by gently pulling down and away from the insertion site. Traction stabilizes the vein and prevents it from rolling. Utilizing a 15 to 30 degree angle, perform the venipuncture and look for blood return. With some catheters, blood return can first be seen along the catheter itself, then back in the chamber. Once you see blood return, lower the angle of the catheter and advance the entire catheter needle unit slightly. This ensures the catheter tip, not just the tip of the needle, is within the lumen of the vein. While maintaining traction on the skin, push the catheter off the needle and into the vein. Traction keeps the vein path straight and prevents bunching of the skin. Release the tourniquet. To prevent blood leakage, compress the vein above where the tip of the catheter resides in the vein. Some catheters incorporate technology eliminating the need for venous compression. Shield the needle and immediately place it into a Sharps collector. Connect an extension or the administration tubing as appropriate for the therapy being administered. Assess for patency by flushing or slowly beginning the infusion. Stabilize the catheter and dress the site according to your policy and procedure. The following tips can help you when encountering insertion difficulties. If you're having trouble advancing the catheter once you've obtained a blood return, lower and advance the entire catheter needle unit once you get a blood return. This assures the catheter tip is also within the lumen of the vein. Maintain traction on the skin and vessel until the catheter is completely in. Hold the needle stationary while pushing the catheter forward. Try the following if you're blowing veins. Lower and advance the entire catheter needle unit once you get a blood return. This assures the catheter tip is also within the lumen of the vein. Maintain traction on the skin and vessel until the catheter is completely in. To prevent blood from leaking out when removing the needle, release the tourniquet before shielding or removing the needle. Imagine where the tip of the catheter is beneath the skin and compress the vessel beyond this point. Review the insertion and troubleshooting steps repeatedly and ingrain them in your mind to help you be more successful when starting IVs. Start inserting IV catheters in patients with relatively good vascular access first to